The itchy spot that could save your life. Why this unusual symptom matters. There's something strange I need to talk to you about today. Something most people, and even most doctors, don't pay enough attention to. An unusual itchy sensation that shows up on your chest, left arm, neck, or upper back, and disappears just as quickly as it came. Most men over 60 shrug it off. Maybe it's dry skin, they say. Maybe I just slept funny. But I'm here to tell you the truth. That itchy spot could be one of the first subtle signs of a heart attack. It sounds bizarre, I get it. You're used to thinking of chest pain or shortness of breath as the big red flags. But what if your body had a much earlier alarm system? One that came in the form of an itch, a skin tingle, or a strange crawling sensation under the skin. What if this was your body's way of whispering to you, hey, something isn't right with your heart? In this 6-part video series, we're going to uncover the 5 earliest and most surprising signs of a heart attack in people over 60. And yes, one of them includes that mysterious itchy patch. I'll explain the medical science behind it, where it tends to show up, and how to know when it's harmless and when it's a red flag. Let's begin with the one that saved more lives than you'd think, the cardiac itch. We call it a referred sensation. That means the heart is under stress, but the pain or symptom doesn't always show up directly in the chest. Instead, it's referred to another area of the body because of the way your nerves are wired. You see, your heart and certain parts of your skin share the same neural highway. When the heart struggles to get enough oxygen, like in the early stages of a heart attack, it may trigger signals along the nerve path that travel to your left shoulder blade, inner arm, jawline, or upper chest. And those signals? They don't always feel like pain. Sometimes they feel like a persistent itch, a tingling, a crawling sensation, like ants walking under your skin. It can last a few seconds, or come and go for hours. Now, does this mean every itch is a heart attack? Of course not. But if you're over 60 and you notice an itchy spot in a very specific place, especially if it's new, unexplained, and keeps recurring, you need to pay attention, especially if it's accompanied by any of the following: mild shortness of breath, light pressure in the chest, even without pain, fatigue or sudden weakness, cold sweat or nausea, feeling off or anxious for no reason. Let me tell you about one of my patients, Carl. He was 68, relatively healthy, walked every day. One evening, he noticed an itch on his upper back near his left shoulder blade. He thought it was a bug bite, scratched it. It faded, came back the next day. This went on for a week. Then one night, he felt a strange tightness in his throat. Not pain, just pressure, and a wave of fatigue. He called his daughter, who took him to the ER. They ran tests, and guess what? He had 90% blockage in one of his coronary arteries. They caught it before a full heart attack. When I asked him what made him go in, he said, "It was that itch. I knew it wasn't normal." That itch saved his life. This is why I want every senior to take body signals seriously. The body speaks in whispers before it screams. The cardiac itch is one of those whispers. It's not loud, but it's important. So what should you do if you notice this? Track the location. Is it near your left shoulder, chest, or inner arm? Notice the timing. Does it show up during rest or after walking or climbing stairs? Look for patterns. Does it return at the same time each day? Pay attention to other symptoms, even mild ones like shortness of breath, fatigue, or jaw pressure. Don't wait. If something feels wrong, call your doctor or go to urgent care. Don't wait for pain. Jaw and neck pain, most men mistake for dental trouble. We've just explored the first unusual sign of a heart attack in seniors, the mysterious itchy spot that quietly warns of oxygen-deprived heart tissue. Now let's move to another body signal that has confused thousands of men over 60 and led them to the wrong doctor: jaw and neck pain. If you're over 60 and have ever felt a sudden tightness in your lower jaw, throat, or neck area, especially without chewing, talking, or dental problems, you need to hear this. Because that discomfort may not be coming from your mouth. It may be coming from your heart. Yes, really. This is one of the most misdiagnosed early heart attack symptoms in older adults, particularly men. It's often mistaken for a dental cavity, a cracked tooth, a sore throat, tension from poor posture. But in truth, jaw and neck pain, especially on the left side, can be your heart's way of saying, "I'm in trouble." Here's how it works. Just like the itchy spot in part 1, this is a referred pain. Your heart and your jaw share neural pathways. When the heart is under duress, it can send pain signals that your brain misinterprets as jaw discomfort. For many seniors, especially men who've had decades of undiagnosed plaque buildup in their arteries, these signals start to emerge weeks or even months before an actual heart event. The pain might come and go. It might feel like pressure, throbbing, burning, or even a dull ache that radiates into your neck, shoulder, or even the ear. Sometimes it feels like TMJ or jaw clenching, but here's the key difference. It's not triggered by chewing or biting. It shows up out of nowhere or during moments of stress, walking or climbing stairs. Let me share a story from my practice. George, a 71-year-old retired welder, came in complaining of jaw pain. He said, "Doc, I think I need a root canal." But his dentist couldn't find anything wrong. The x-rays were clear. I asked him when it started. He said, "Right after shoveling snow last week. My jaw just started hurting. Then it came back again after mowing the lawn." That was the red flag. We ran a stress test and EKG. Within 2 hours, we confirmed 90% blockage in his left anterior descending artery, aka the widowmaker. He had no chest pain, just jaw pain. We got him into surgery, and we saved his life. This is why I say, if you're over 60 and your jaw or neck hurts for no obvious reason, do not ignore it, especially if it comes on during exertion, walking, stairs, yard work, goes away with rest, is accompanied by sweating, fatigue, nausea, or shortness of breath, feels worse at night or when lying flat. This is your window. The heart sends warnings before it crashes, but those warnings are often subtle, especially in older adults. In fact, studies show that up to 50% of seniors who suffer a heart attack never experience classic chest pain. Instead, they report things like mild back discomfort, neck tension, toothaches, fatigue, or dizziness. So what should you do if you notice this? Track when the pain occurs, during rest or movement. Note the duration. Is it fleeting or lasting more than 10 minutes? Pay attention to recurrence. Does it come back during the same type of activity? Combine it with other clues, breathlessness, nausea, or lightheadedness. If the answer to any of these is yes, get checked. Don't pop ibuprofen and wait. Don't waste 2 weeks on dentist visits. Go see your primary care provider. Or better yet, get a cardiac stress test. The scariest thing about heart attacks is that many don't start with pain in the chest. They start with strange discomfort elsewhere. That's especially true in older adults, and it's even more common in women. But men aren't safe either. That burning chest feeling might not be heartburn. It could be cardiac distress. Let's now explore the third silent signal of a heart attack after 60. Something almost everyone mistakes for a common annoyance: heartburn. That burning sensation behind your breastbone, the sour taste in your throat, the mild pressure that creeps up after a meal. Most older adults shrug it off and reach for an antacid. But here's what you need to know. If you're over 60 and you're getting frequent indigestion or acid reflux that doesn't respond to meds or comes on during activity, it may not be your stomach. It may be your heart. You see, the esophagus and the heart are located very close together. Their nerve pathways even overlap. This makes it easy for your brain to misinterpret pain signals. What you think is acid splashing into your chest might actually be oxygen-starved heart tissue crying out. Here's a key question I always ask my patients. Does the burning show up only after meals? Or can it appear during a walk, a climb, or emotional stress? If your burning chest sensation comes when you exert yourself, even lightly, or if it worsens when you're lying flat at night, it deserves immediate attention. Let me tell you about Rose. She was 74, active, loved gardening, came into the clinic complaining of terrible acid reflux for 2 weeks. She had no appetite, said it got worse every evening after walking her dog. She'd pop a Tums and wait it out. Her EKG? Abnormal. Her enzymes? Elevated. We rushed her to cardiology. She was hours away from a massive heart attack. The diagnosis? She wasn't having acid reflux. She was having angina. Angina is chest discomfort caused by reduced blood flow to the heart muscles. It often presents as a tight, squeezing, or burning sensation in the center of the chest. Pain that radiates to the neck, jaw, or arms. Discomfort during physical activity or emotional stress. Relief with rest. In older adults, especially those with diabetes or hypertension, angina often mimics digestive problems. That's what makes it so dangerous. Now, how can you tell the difference between indigestion and cardiac distress? Here's a quick guide. Likely heartburn. Comes directly after eating spicy or acidic food. Improves with antacids. Does not involve sweating, dizziness, or shortness of breath. Possible heart problem. Comes during walking, talking, or emotional moments. Doesn't fully go away with antacids or comes back fast. Feels like pressure, not burning. Accompanied by fatigue, nausea, or cold sweat. What most people don't realize is that many seniors have silent heart attacks, meaning they don't experience intense chest pain. Instead, they feel unusual fatigue, shortness of breath, mild burning or tightness, digestive discomfort that seems to come and go. If you've been diagnosed with GERD or acid reflux, but your symptoms are worsening, changing, or not responding to medication, don't wait. Request a cardiac workup. Ask for a stress test, EKG, and possibly a calcium score scan. You deserve to know what's really happening. Because I've seen too many cases where men and women said, "It's just heartburn," and then collapsed days later with a major cardiac event. Your body is trying to tell you something. Listen, here's one last tip. If you ever feel chest burning during the night and you wake up sweating or anxious, don't write it off. Nighttime angina is a warning sign of blocked arteries. If that burning wakes you from sleep, call someone. Don't wait until morning. The silent danger of sudden fatigue and breathlessness in seniors. Let's move on to the fourth and perhaps most underappreciated early warning sign of a heart attack after 60. Fatigue and shortness of breath. These two symptoms are often dismissed as normal aging, but I want to challenge that idea. Because when these issues come on suddenly or get worse over weeks, they could be the clearest signs your heart is in trouble. Let me ask you this. Have you recently gotten winded going up a single flight of stairs? Have you found yourself napping more even after a full night of sleep? Do you feel like everyday tasks, like carrying groceries or walking to the mailbox, drain you faster than they used to? If you're over 60 and you've said yes to any of those, don't just assume it's your age. Your heart might be struggling to pump enough oxygenated blood to your muscles and brain. and that's a problem we need to catch early. Here's why it happens. Your heart is a muscle. When arteries are blocked, even partially, your heart has to work harder to push blood through narrow passages. That extra effort causes your body to slow down other systems to conserve energy. You become tired more easily. Breathing becomes labored. You might even feel like you can't get a deep breath, especially when lying down or climbing. And here's the most overlooked truth. Fatigue is one of the most common early symptoms of a heart attack in women, but men experience it too. They just don't always talk about it. I had a patient, Arthur, 67. He told me he had no chest pain, no heart problems. But his wife said, he's been falling asleep in the chair by 7 p.m., and that's not like him. He said he just felt off. No real explanation. We checked his labs, ran an EKG. His BNP, a marker for heart stress, was elevated. He had early-stage congestive heart failure. We caught it in time. With medication and lifestyle change, he bounced back within weeks. So what should you watch for? Sudden or unexplained fatigue, especially after light activity. Breathlessness, walking across a room or climbing stairs. Needing more naps or sleeping longer than usual. Waking up tired even after 7 to 8 hours. Dizziness or lightheadedness after movement. If these symptoms come on gradually, people often adjust their lifestyle without realizing it. They stop walking the dog. They take the elevator instead of stairs. They avoid family outings. But the fatigue doesn't go away. It gets worse. That is not normal aging. That is your heart saying, I'm not keeping up. And here's another red flag. Breathlessness while lying flat. If you find yourself needing more pillows at night or gasping slightly when lying on your back, that can signal fluid buildup in the lungs, a hallmark of heart failure. So what can you do? Start tracking your fatigue. Keep a journal for 7 days. Note how often you nap, how tired you feel after basic activities, and whether the tiredness fades or sticks around. Monitor your breathing. Can you climb a flight of stairs without pausing? Count your resting heart rate and oxygen saturation. A cheap fingertip monitor works great. Ask for a BNP blood test and an echocardiogram. These will reveal if your heart is straining silently. Fatigue is easy to ignore. It's not painful. It doesn't scare you like chest pain. But it can be your earliest warning that something is brewing inside your arteries and that your heart is falling behind. Please, do not dismiss it. Cold sweats and clammy skin, the warning sign hiding in plain sight. Let's talk about one of the most chilling symptoms of an oncoming heart attack. One that literally makes your skin scream for help. Cold sweats. You're sitting quietly. The room is cool. There's no fever, no workout, no panic. But all of a sudden, you feel dampness on your chest. Your shirt sticks to your back. Your skin gets cold and clammy. Maybe your hands tremble. Maybe you feel lightheaded. It passes in a few minutes. Most people chalk it up to stress, anxiety, or maybe blood sugar. But here's the truth. If you're over 60 and you're suddenly breaking into a cold sweat for no clear reason, it could be a sign your heart is in distress. Here's the science. When your heart isn't getting enough oxygen, like during the early stages of a heart attack, it sends emergency signals to your autonomic nervous system. That's your body's internal 911. And one of the first things it does is trigger the sweat glands, especially in your chest, back, forehead, and palms. This kind of sweating isn't like what you feel on a summer walk. It's usually accompanied by nausea or queasiness, lightheadedness or faint feelings, rapid or irregular heartbeat, pale or grayish skin. It's your body's way of saying something is very wrong and I'm trying to compensate. One of my patients, Linda, was 69. She wasn't even concerned about her heart. came in thinking she had the flu. She said, "Doc, I woke up drenched in sweat, like I just run a marathon in my sleep. Then I got dizzy walking to the bathroom." We ran her labs and EKG. Within the hour, she was in the cardiac unit. Silent heart attack. She had none of the usual symptoms, just the cold sweats. This symptom is especially dangerous because people delay acting on it. They don't call 911. They don't mention it to their doctor. They say it passed, but what it's signaling is urgent. Here's what to watch for: sudden onset sweating without heat, exercise, or fever. Clammy skin that feels sticky and cool to the touch. Sweating paired with chest discomfort or jaw, neck tightness. Sweating after walking, climbing stairs, or light housework. In older adults, this symptom may appear during the night, especially in men. You may wake up soaked. You may think it's just a warm blanket or a bad dream. But if your skin is clammy and your heart is racing, or if you feel weak or nauseated, take action immediately. I always tell my patients, sweating should make sense. If it doesn't, something is off. So what should you do if you experience this? Sit down and monitor your symptoms. Are you dizzy? Is your chest tight? Are your hands trembling? Check your heart rate. If it's unusually high or irregular, note it. Take your blood pressure if you can. A sudden drop is a red flag. If symptoms don't resolve within 5 to 10 minutes or return quickly, call emergency services. You may think, I don't want to overreact, but here's the truth. Overreacting once might save your life. Underreacting could end it. Remember, heart attacks in seniors don't always start with the Hollywood-style chest-grabbing scene. Sometimes they start with an itch, a bit of jaw tightness, or a bead of sweat on your temple. The complete action plan: what to do if these signs show up. We've now uncovered 5 subtle but powerful early signs of a heart attack in seniors. Each one easy to dismiss, but each one dangerous if ignored. Now in this final part, I want to give you a simple, step-by-step action plan. Because knowing the signs is not enough. You need to know what to do the moment they show up. Let's say you experience one of the following: that itchy spot on your chest, shoulder, or arm, unexplained jaw or neck pain, burning or tightness that feels like heartburn, sudden fatigue or breathlessness, cold sweats or clammy skin. Here's exactly what to do, whether it happens at home, at night, or even if you're alone. Step 1. Sit down and stay calm. Panic can worsen heart symptoms. The first step is always to sit in a safe, upright position. Take slow, deep breaths. Do not lie down flat. Step 2. Take inventory of symptoms. Ask yourself, am I lightheaded or dizzy? Is my heart racing or skipping? Do I feel pressure in my chest, neck, or arm? Is this discomfort different than usual? Step 3. Chew 325 milligrams of aspirin, if not allergic. If you suspect a heart issue, chew, not swallow, 1 adult aspirin. It helps thin the blood and can reduce the severity of a heart attack in progress. Step 4. Call emergency services. 911. Do not wait. Don't see if it passes. Tell them clearly, I'm having heart symptoms. I'm over 60. I need help now. Step 5. Unlock your door and sit near the entrance. This simple step can save responders time. Sit in a visible place where you won't be missed if you lose consciousness. Step 6. Do not drive yourself. Even if you feel okay, driving during a cardiac event is dangerous. You could pass out or crash. Always wait for trained responders. Step 7. Alert a family member. If someone is nearby or reachable by phone, tell them what's happening. But don't delay calling emergency services while doing so. Now let's talk about prevention. Because the best heart attack is the one that never happens. If you're over 60, Here's your daily defense strategy. 1. Know your numbers. Get your blood pressure, cholesterol, blood sugar, and weight checked regularly. These are the big 4 heart risk factors. 2. Move every day. Walking 30 minutes a day can reduce heart attack risk by up to 50%. Even small steps help. 3. Eat for artery health. Focus on leafy greens, berries, fish, nuts, olive oil. Avoid trans fats, excessive salt, and sugar. 4. Sleep matters. Less than 6 hours of sleep per night increases heart attack risk by 20 to 30%. Prioritize deep, restful sleep. 5. Manage stress. Daily breathing, prayer, meditation, or journaling calms your nervous system and reduces blood pressure spikes. 6. Stay connected. Isolation increases heart disease risk. Talk to friends. Join a group. Stay emotionally involved with life. 7. Get regular heart checks. Ask your doctor about a coronary calcium scan, EKG, and stress test if you're over 60 and have risk factors. You may not be able to change your age, but you can change your odds. Your heart is more than a pump. It's your body's engine, your emotional center, and your source of daily life. And like any engine, it needs care, signals, and early warning sensors. Now you know what those early warnings look like. Don't wait for the crushing pain. Don't wait until you're in an ambulance. Don't wait until it's too late. If you feel something's off, itch, pressure, fatigue, sweat, trust that instinct. That's your heart talking, and it only gets louder from here. Let's take care of it while it's still whispering. Stay vigilant, stay alive, and share this video with someone you love. Because heart attacks don't just come out of nowhere. They announce themselves if you know how to listen. Dr. James Hartley, signing off with care.